Ask Joel Crandall to come up and speak about the strength work, if you would, a few minutes to give us some of the principles, because we're going to be working both the AIS stretching and strengthening during the course of the day. All right?
We're just talking about why we do the AIS strengthening work. It's very important. You see someone like myself and John here did a lot of bodybuilding, and you think they can do anything with the strengthening work, but don't make that assumption, okay? Don't make that assumption, because everybody usually has their issues where they're tight or where they're weak. All right, so that's why we want to go over some of the strengthening work to get the local endurance in the muscle. With the stretching, we get it opened up. Now we got to strengthen it so it can maintain that range of motion. So here we go with some of the reasons why. We want to balance the muscles that are surrounding the joint. We want to build stability through the entire range of motion of the joint. You have someone who's hypermobile. You really need to do the strengthening work because they're so flexible. If they're not strong, they're going to end up injuring themselves. You see, like you saw a lot of that with the gymnasts. As they get older, they're going to start having the shoulder issues, etc. We want to reinnervate the neuromuscular pathways. Some of these muscles haven't been their full range of motion in a long time, so we want to reinnervate that. And we want to build the local muscular endurance to the weak postural muscles. Okay, that's a lot of what we work with, the weak postural muscles. All right, a lot of us have heard about tensegrity. This is what we talked a lot about in DC. This is a quote from Mr. Eric Dalton. Deep intrinsic muscles and the body's bony framework are inseparable. What affects one always affects the other. So we're working a lot with the muscle tissue, but we're actually moving fascia. Okay? It all connects together. Muscle imbalance patterns develop from a bombardment of abnormal neurological information to the spinal cord and the brain. That's from Vladimir Yonda. Some of the reasons we talked about could be aging, some genetic influences, habitual patterns. We're doing the same thing all the time. Ladies, if you had a baby, you're holding them on your hip, you're doing everything with your right side. If you start getting into some of those patterns, that's where you'll start developing issue. Joint blockage, we talked a little bit about frozen shoulder already. And then what we saw with Mike in the video was excess physical demand, and actually in a position that the body shouldn't be in. This is what we're working with, postural endurance. This slide is actually for Aaron. Anybody know who that is? That used to be Aaron.
My hair were long.
That's Noriev, one of the world's greatest ballet dancers. Aaron's worked on him, so that's why that slide is in there for him. So that was for you, big guy.
Thank you.
So we need to build the endurance in the postural muscles, and most of those are in the posterior chain and the abdominals. Tight muscles create asymmetry, but the weak muscles permit their asymmetry. All right, so you have a tight chest, it's going to be tight, it's going to allow, the rhomboids are going to turn off, right? They're inhibited because of the tight chest. So that's why we want to open the chest and strengthen the back so we can hold that posture with the endurance. This again is from Vladimir Yonda, his tight and weak. I added a few things on here. I actually split the hamstring. Usually the hamstring's tight at the bottom and weak at the top of myself. But typically it's the anti-gravity muscles here. So we want to stretch and open up all the tight and facilitated muscles. We also need to stretch the weak and inhibited because they've been inhibited. They're on an excessive stretch for so long. We still need to get blood into those areas, but it's very important to strengthen these areas. Here's for the lower body. Here's the big one, iliopsoas. Very tight, and that will inhibit the glutes. Pretty much anywhere where you see a short angle, like here in the neck, here in the back, those are going to be tight. Where you see an angle that's larger than 90, here and at the lower abdominals, are areas that are going to be weak. All right, so all of these need to be strengthened, but the lower abdominals will change the posture of the lower back. Right? So you need to strengthen the lower abdominal, you need to strengthen the neck to pull this back. Okay, Dan. We've all been here. The reason I wanted to show this is because this is a habitual pattern. But as we're sleeping, psoas is a little short, glutes are getting long, hamstrings are getting short, calves are getting short. Look at her neck. She's probably been like that all day on the computer already. And then we're talking about with the arm being in external rotation. Okay? So these are just some of the things you want to look for and keep in your mind's eye when you're working on somebody. Obviously, we've all seen this and have corrected this with the forward head posture. Very tight, but very weak here. Very tight here. Pectorals, extremely tight. Posterior rotator cuff, rhomboids, extremely weak. And we got the lower part, which we talked about already. The abdominals being weak, giving you that little bit of a sway back. But we also need to strengthen the thoracics, to pull those thoracics back down so the chest will be lifted up, so shoulders can come back. So you can see the tensegrity. Everything's going to match into each other to help out. So my idea is to stretch, then strengthen. You want to release, if you're doing a deep squat like this, we talked about the psoas being tight already. If the psoas is tight, the glutes are going to be weak. Okay? So a lot of times in a squat, people can come down fine, but if their calves are tight, they can't. So you're going to need to open up the calves so they can get that deep. But the other thing you find, the psoas is always tight. When they come up, they stay here. They never finish. So where they can actually squeeze the glute. And the reason they can't is because their psoas is tight. So if we stretch the psoas first, it'll make it much easier to strengthen the gluteals. Rhythm and reps. 3 seconds up, the concentric contraction. 5 seconds on the way down. Okay, we do everything very slowly to build up the local endurance of the muscle. Okay, so it's 3 seconds up, 5 seconds down. The eccentric is pretty much key to the strength. That's where a lot of the strength in the muscle is going to come from, is that eccentric contraction. You'll see a lot of people, they'll be up here, and they'll start coming down, and then they'll drop to the table. They've missed all that strength work. And that's the important stuff. So be focused with your clients about making sure they're doing the proper technique. Use eccentric contractions with neurological disorders. Okay? You've seen Aaron a lot using the manual strength work with some of the quads he's working on. He's working with the eccentric contraction. Does that just connect to the brain a lot better? I'd like to bring you in for a second on that, to add to that.
You're able to get more nervous firing on eccentric than you are on concentric, especially if you're under control. Because you're not overcoming gravity coming up like you are with
taking longer time.
Post-polio or cerebral palsy or any type of disorder that we're seeing more and more of. The nervous system gets much better involved on the negative, and all of a sudden the positive starts to work better because you're retraining that whole chain.
You're using the nervous system for a longer period of time with the eccentric contraction.
Right.
So it's having more time to connect. I'll get you in a second, Terrence, okay? When you're working with the nervous system, I find I only do 3 to 5 repetitions. Sometimes I might even do 1 or 2. And the reason being, they haven't done anything in a long time. And you'll see them either start to shake. Sometimes that'll happen anyway. But if they really start to shake, or if you start to see them losing, I hate to say it's integrity, but the tensegrity or the integrity of the movement, the nervous system has been fried. So you need to give that time to relax. If I sit there and I try and do 12 with someone who's never done it, lactic acid is building up, but also the neural pathway is being blocked. There's too much information for them right now. So give them a break, come back to it. It's very important when you're working with the nervous system.